If it's causing problems in your relationships, at work, you can't show up to work, or you're spending a lot of time recovering from your substance of choice, you're thinking about it a lot, planning your life around it, it's time to seek out help. My name is Kelsey. I'm an LCSW, or licensed clinical social worker, and I've been working for CLEAR since 2022, and I've been in the field of addiction and mental health since 2019. Most of the time you will find the warning signs have to do with physical or mental health. A lot of times with alcohol, you'll start to see gastric issues or liver issues, pancreatitis, things like that. You'll also see that with a couple of other drugs as well. And in terms of mental health, your depression, your anxiety is getting worse. Sometimes suicidal ideation is a big indicator that you need to seek out help. It's time to go to addiction treatment when you're really struggling with substances. If your substance of choice, whether it be alcohol or pills, weed, whatever it takes, if it takes up the majority of your life. So if you spend a lot of time using, like let's say you go on that 4-day bender and you spend another 4 days recovering from it, that's 8 days that you are not able to go to work or engage in your relationships or participate with your kids or your hobbies. And so that's what I mean by it. It takes up the majority of your life. If it's causing problems in your relationships, at work, you can't show up to work, or you're spending a lot of time recovering from your substance of choice, you're thinking about it a lot, planning your life around it, it's time to seek out help. Even if you just think that you use a little bit too much, it's better to seek out addiction treatment. Based on my experience, the most important steps to take to stop doing drugs is to seek out, especially detox treatment, if you're doing substances like alcohol or opiates, to have a safe withdrawal. That is what you need. Seeking out treatment, engaging in outside support groups, gaining a community, and participating in therapy and group treatment as well. Yes, rehab works. I have worked in this field for such a long time, and I have been witness to the successes that people have had going to treatment and rehab. The evidence is very supportive. If you combine outside support groups and rehab, your success rates can be up to 70%, which is enormous. And so it definitely works. There's evidence. So there's no timeline for recovery. It matters how much effort that you can put into it. So a typical stay in treatment here at CLEAR is either 30 days in residential or up to 90 days in outpatient or dual diagnosis. So it takes a while, but the journey is lifelong. So inpatient typically is an average stay of 21 to 28 days. Once that is done, we typically would recommend a PHP or IOP program, which our PHP and IOP lasts for a total of 90 days. So it's about 120 days of treatment in total. As I said before, it's a lifelong experience, but typically that's what you will see. In terms of the determination of how long somebody will be in treatment, it depends on the person. We are very flexible to people's schedules to be able to accommodate. Like if you have to work, we'll figure out how to get you in treatment so that you can receive the treatment that you need. In addiction treatment and rehab, a typical day would look like groups, which can cover anything from psychoeducation on addiction, coping skills, relapse prevention techniques, as well as an introduction into like a 12-step process or support groups outside of treatment. And you'll do an individual session once a week with a therapist, as well as once a week you also meet with a counselor for substance use. Typically, I will see clients that are anywhere between I really, really want this and I'm here for my family. And I feel like at Clear, we have this unique environment where mostly everybody that is here is in recovery themselves. And I feel like that just creates this environment that is safe and that they can trust. Like we have the experience that the people need to trust us and really learn how to invest in their treatment. I always tell them, like, I don't care what brings you in, as long as you're here. And if that keeps you motivated, let's keep that, and we'll figure out why we need to do this for you. And I feel like at Clear, especially, it's a different kind of environment to where we can really facilitate that, and we just have not fun, but we are able to just provide a really friendly experience with people, and we love our clients and we get to know them.